Hello, good afternoon, and thank you for joining us today for our PACE and PACENET webinar. My name is Samantha Purcell. I'm a Medicare specialist with URL Insurance Group, and I will be your host today. The webinar will be recorded so that you can go back and watch it at any time at your convenience in our training library area on our website. We do about 1 to 2 educational webinars a week, so if you missed any that we've done recently, you can also find them in our library. Let me quickly walk you around our screen. You should see the slides nice and big in the middle of the screen here. On the right side, there is a chat bubble that you can click, and that will open up a chat window for you to either address the group or ask a question at any time during the webinar today. So today's webinar is about PACE to give us a deep dive into how it works so that you can better assist your clients. We have Rebecca Lorah, the Outreach and Enrollment Manager from the PACE program. She has spoken at our Medicare Connections Conference for the last several years, and we are extremely happy to have her back. So without further ado, I would like to present to you Rebecca Lorah.
Great, thank you. So I'm going to provide the PACE and PACENET information about our program, but also some related program services that we provide for other state agencies. So the PACE program is a comprehensive drug benefit for older adults that offers low-cost prescription medication to qualified Pennsylvania residents. It is creditable coverage, and it wraps around Medicare Part B and Part D and other insurance coverage, which I will discuss a little further in depth. PACE offers first dollar coverage with no deductibles. We have an open formulary. There's nominal copays. We have no caps. And again, we have the seamless wrap with Medicare Part B, D, and other insurance coverage. And we do provide a drug utilization review to protect our cardholders. To qualify for the PACE program, an individual must be 65 years of age or older, be a Pennsylvania resident for at least 90 consecutive days, and meet the income eligibility guidelines. And an individual can also not be enrolled in Medicaid prescription benefits. They could have SNAP benefits, for example, but not the prescription part of Medicaid. So when we talk about income eligibility, we look at gross income. And to qualify for PACE, so there's PACE and PACENET, there's like a second tier, which is PACENET. So PACE, for a single person to qualify, is their income must be $14,500 or less. And for a married couple, it's $17,700. And for PACENET, that's where the tier kind of increases a little bit. A single person must have an income less than $33,500, and a married couple must be less than $41,500. And for those who aren't aware, back in February of 2022, our income levels did increase by $6,000. So just want to point that out to make sure people are aware, and we're still spreading that information out to our partners and to the public, just because some people may have thought that they did not qualify in the past, but I just want to make them aware that we have increased that income. Part B premiums are excluded when we look at income, and assets are not counted when we look at qualifications for the PACE-PACENET program. The program provides an open formulary to our cardholders and a pharmacy network with low prescription copays. When we look at a 30-day supply of what a generic would cost, for PACE cardholders, a generic is $6 for a 30-day supply, and for brand, it's $9. For PACENET, it's $8 generic and $15 for brand. So an individual with just a PACE or PACENET card can only get a 30-day supply at a time, but an individual who does have a Part D plan that allows a 90-day supply can go ahead and have that fulfilled at one of our participating providers. So we do encourage individuals to be enrolled in both PACE or PACENET and a Part D. And the reason for that is there's a lot more benefit to the cardholder and to the program for being enrolled in both. So PACE and PACENET provide coverage during Medicare Part D deductibles and coverage gaps, which would be the donut hole. PACE and PACENET cover some medications that Medicare Part D plans will not cover. So PACE and PACENET come in and just cover that medication. PACE covers any copays in excess of the PACE copay amount. And we also pay some Medicare Part D premiums that's PACE specific. I'll get into that a little bit. And we also pay full late enrollment penalties. So I'm sure you know the lifetime penalty. The LEP is a lifetime penalty of 1% of the base beneficiary premium for every month eligible but not enrolled in Part D. So we found that a lot of our enrollment were hesitant to go ahead and sign up for a Part D because they hadn't when they were 65 and they had incurred this penalty and did not want to pay that or could not afford to pay that. So we found that it was more beneficial for both the enrollee and the program to just pay that penalty for them and get them into a Part D. In order to take advantage of that, though, they have to be enrolled in one of our premium payment agreement plans. So some other benefits to being enrolled in both, there may be lower copays because of a Part D, that 90-day supply that I spoke about, if that's offered by the Part D plan. And obviously, you know, that having them enrolled in a Part D really offsets program costs significantly for us so that we can continue to enroll more of our seniors. So when we talk about Part D plans, we have what are called partner and non-partner plans. And the partner plan process is, you know, it's kind of completed through an RFI process, and, you know, the plans have to submit to us and qualify for becoming a partner plan, kind of to sum that up in a nutshell of how we get here. But the partner plans for 2023 right now are WellCare Classic and SilverScript Choice, and I've provided their monthly premium amounts on this slide. And then we also have non-partner plans, and all of our plans, regardless partner or non-partner, they must have a signed premium payment agreement with the program. So rather than list all of the companies, I just listed the website. So a full list can be found on our website at pacecares.magellanhealth.com, and you'll be able to find all of the plans that we work with through the signed premium payment agreements. So when we talk about partner and non-partner, it kind of comes down to also premiums as well, and the difference in who pays the premium and where. So if an individual is enrolled in the PACE program and they're enrolled in a plan that has a signed premium payment agreement with the program, we're going to pay their premium up to the regional benchmark of $41.08. So if they have a $50 monthly premium, we're going to at least pay that $41.08 for them and help them. And again, that's if they are enrolled in a plan that has the signed premium payment agreement. Now, PACENET's where it changes a little bit. If a cardholder is enrolled in a partner plan for PACENET and PACENET, the premium is paid at the pharmacy through the cost of the drugs. I do have some examples to show because I know that gets a little confusing. The monthly premium does not accumulate or carry over, and if the cardholder skips a month at the pharmacy, it still does not carry over. That is also something new as of last February of 2022 through some of our new legislation that has passed. And if an individual is enrolled in a non-partner plan, the premium is paid directly to the plan through the monthly billing. So a non-partner plan, they pay directly to the company. A partner plan, which is the WellCare and SilverScript, they're going to pay at the pharmacy through the cost of their medications. And an individual without a Medicare Part D is also going to pay the monthly benchmark premium at the pharmacy. It's the $41.08 through the cost of their drugs. The monthly premium does not accumulate. And if the cardholder skips a month at the pharmacy, it does not roll over and does not accumulate. Again, that's something new. So I have a few examples I just want to run through quickly. I have two examples. One is PACENET with Medicare, and one is PACENET without Medicare Part D. So starting with the very top one, with the SilverScript Part D plan's monthly premium is $39.60. An individual goes into the pharmacy on January 12th of 2023, and they have a prescription filled, and the cost of the drug is $8.25. The cardholder is charged the $8.25, and this amount goes towards the premium of $39.60. So they have $31.35 remaining of their premium that they still need to pay. Prescription is filled on January 13th. They have to go in the next day. Cost of the drug is $14.20. Cardholder is charged the $14.20, and that amount goes towards the remaining premium of $31.35. They still have $17.15 remaining for January. However, they don't go back. They go into the pharmacy on February 1st of 2023. The $17.15 premium remaining from January does not roll over to February. It just starts over. So it does not accumulate, and it just starts over as that $39.60. So I hope that kind of breaks it down to show how they pay the drug cost, how they pay the premium through their drugs, to try to make some sense of that. Very similar scenario without Medicare Part D. I used 4108 as the benchmark premium here. Use the same totals, cost of drugs, I mean. So they go into the pharmacy on January 12th. The cost of the drugs, $8.25. Cardholder is charged that amount, goes towards the premium. There's $32.83 remaining. They go in the next day on January 13th. Cost of the drug is $14.20. Cardholder is charged $14.20, and the amount goes towards the remaining premium. So again, they have a remaining premium, but they don't go back into the pharmacy until February, and that amount does not roll over to February, and they are not responsible for paying the remaining. So just a little example to try to break that down. I know that's one of the most confusing things for us. We'll get a lot of questions on that and how it works. So I just wanted to kind of put that out there in some example slides for you. One of the unique things about us too is that we do not have a renewal process. We don't require our cardholders to submit an annual renewal application every year. We use, this is completed using file exchanges on the back end. So we have partnerships and agreements with, entities, local, state, and federal entities such as Social Security, CSRS, PCSRS, just to be able to pull that information, in so that we don't have to burden our cardholders in submitting anything. And then, of course, if someone is switched from program to program, or if they actually, it looks like they've made too much money, then they receive a correspondence indicating any changes. And we do provide an appeal period, an appeal process for them if they believe that something, was missed or something. I have all the information here for how to apply. We do take applications over the phone. We don't, like I said, we don't require any income documents or anything when first applying. So just calling the 800-225-7223, someone can complete an application over the phone. We do have an online enrollment system at the pacecares.magellanhealth.com site. You can print an application and mail it in, email, fax. And then the other piece of this that I wanted to talk about is this PACE Application Center phone number, and go through what we do with the PACE Application Center. So the PACE Application Center is actually based out of Philadelphia. It's the result of a longstanding relationship between the Department of Aging and Benefits Data Trust, or BDT. BDT, we provide them with lists of those who from other agencies and entities who we believe may be eligible for benefits who are not yet enrolled. So we have people on PACE who we know would be eligible for LIS or SNAP or PTRR, property tax rent rebate, and then they complete outreach. They complete outreach and send letters to these individuals, multiple letters, trying to get them to respond. So they call in to this, the 866 number there, and they are screened for these different benefits. And we don't just screen them and say, oh, these are the benefits that you're eligible for, thank you very much. We actually take it a step further, and we submit applications on behalf of consumers and collect verification documents when needed to make sure that they actually take the steps to get enrolled into the program. Has a much higher success rate when you walk them through the process. But again, the different benefits that they're screened for are PACE, or if they're not enrolled in PACE, senior food box, low income subsidy, SNAP, LIHEAP, PTRR. I feel like I'm forgetting, and they are enrolled. They are screened for Medicaid as well. So that's our outreach piece of it, to try to maximize the number of people we can get into these benefits and help the number of people eligible. Again, we do provide, we do encourage them to be enrolled in LIS. We actually have an auto apply LIS low income subsidy process that BDT actually helps us with. So if we do have PACE or PACENET enrollees and we think that they're eligible, we try to submit on their behalf. Again, LIS, you have to be enrolled in a Part D plan in order to apply or be eligible for LIS. And this is actually a benefit for both the cardholder and the program, because LIS will provide financial assistance for paying Part D premiums, annual deductibles, and also drug copays. So definitely a cost savings for everyone all around, not just for the cardholder, but for the program as well. So we have another program that, that helps those who do not qualify for PACE or PACENET. Some of you may or may not be familiar with it, but it's the PACE Clearinghouse. We have people who still just need help, but they just don't have the income qualification or even the age for PACE or PACENET. So the Clearinghouse assists underinsured and uninsured individuals with the cost of prescription drugs. They do this through applying people through manufacturer patient assistance programs. We have Attorney General settlement programs where, the Attorney General had some, there were lawsuits, and, these are settlement agreements that came in, and they've provided us with the funds, but made them specific to, for certain reasons that they're used for. The Clearinghouse also looks for any sort of copay assistance and generic mail order forms, coupons, things like that. But it's not a prescription insurance plan. It's just another avenue to try to help individuals with the cost of their medications. But the other thing that we're trying to really stress is that the Clearinghouse doesn't just work with anybody who needs help with prescriptions or medications. They do more. They're more of a social and life services group at this point. They'll help with any sort of medical and prescription programs, any food programs, housing assistance, employment, social and life services, any of these examples, such as finding food pantries. If someone's looking for a job, we try to help them find job or job training. Social and life services, for example, any kind of transportation. We've helped people get furniture, clothing, things like that. We had a case recently where an individual needed $4,800 to replace her furnace, and our group was able to find enough assistance through multiple programs to help get this elderly individual the money for the furnace to be replaced so that she didn't sit in the cold all winter. So just things like that, just examples like that I can provide to you that the Clearinghouse does. The Clearinghouse, to utilize the Clearinghouse, an individual must be over the age of 18, a PA resident, and there's no fee to call the Clearinghouse. But when I talk about these other programs that they can assist with and refer to, some of those might have some sort of fees or income limits or guidelines or something. A number for that is 800-955-0989. And I will be sure to, again, share the slides, and I'm sure they'll be sent out to you, hopefully, to capture all of these phone numbers and links and things. So we have some other programs that we assist, that PACE assists, provides administrative support for other state pharmacy benefits through both the Department of Health and for the Department of Human Services. And those include the Chronic Renal Disease Program. And then we have two special pharmaceutical benefits programs, one for HIV/AIDS and one for mental health. So I'll go through these a little bit just so that you're familiar with these programs in case you have an individual in any of these, in need of any of these programs. So CRDP is a chronic renal disease program, provides life-saving care and treatment for those who have end-stage renal disease. And you can see there's a list of things that they assist with the costs for, including medications, dialysis services, renal transplantation, inpatient and outpatient service, home dialysis supplies and equipment, limited patient transportation. And then they also provide, they pay for Part D premiums for individuals as long as they're enrolled in one of those premium payment agreement plans that I talked about earlier. To qualify for CRDP, an individual has to be a resident in Pennsylvania for at least 90 consecutive days, U.S. citizen or legal alien, 21 years of age or older, and then there is an income guideline for this of gross income at or below 300% of the federal poverty level. So I did provide a link to more information and also to the application and the phone number here for more information. And the Special Pharmaceutical Benefits Program for HIV/AIDS is a program through Department of Health as well. They provide services for individuals living with HIV/AIDS, including pharmaceutical assistance, specific lab services, and then they also provide pay premiums for Part C and D coverage. And again, an individual must be enrolled in a premium payment agreement plan for them to be able to pay that. They have to have, of course, the diagnosis, be a PA resident, and their income has to be at or below 500% of the federal poverty level. And then with this program, very similar to PACE, they cannot have pharmacy benefits under medical assistance. Again, I provided the link here to the printable application and the online enrollment site and the phone number for more information. And then the next one is another special pharmaceutical benefits program, but this one is with Department of Human Services. This one is for mental health and assists with payment of specific atypical antipsychotic medications for qualified participants who are not eligible for pharmacy services under Medicaid. So again, this is a program where you cannot have prescription medication through Medicaid and also be enrolled in this program. So, and you can see they have a very closed formulary. I believe there's nine medications that they'll actually cover. So the income limits, $35,000 gross income per year for an individual. And then for families, they'll provide an allowance of $2,893 for each additional family member. Must be a PA resident, diagnosis of schizophrenia. And also I provided, again, the link to the more information, application, and the phone number for more information. And that is all I have. I provided my contact information. If you would have additional questions, please don't hesitate to reach out at any point. And, you know, even months beyond this presentation, if you have any questions, feel free to reach out directly. It looks like we do have some questions here. I can go through the questions if that's the next step here.
Yep.
Okay. Can you describe how it works for a drug more than the premium amount? So the cardholder is never going to pay more than that premium amount. So if a drug is $100, they won't have to pay the $100. They're only going to pay up to, they'll never pay more than that. And I can provide more examples. I see the next question is related to that too. A drug that costs more than the premium amount, I guess that's the same question, but I can provide more examples. I guess that's one I can also include in addition future slides as well, because that is a good question. But I can include that in an email when, and maybe this group can send it out.
Yeah, absolutely.
I think that's the best way to do it than trying to walk through verbally the numbers. It's good to see it on paper as well.
Yeah, perfect. I'm just going to hop back on here. All right, so thanks so much, Becky. It doesn't look like we have any other questions coming in. So there might be. So Lauren said, thank you. You're welcome. But that was extremely educational for me, and I know for our agent partners. We will have these slides on our website for your access. And also, if there's any other questions that you would like to discuss from the webinar, you can always reach out to the Medicare team here at URL Insurance Group as well. I know that the PACE website is a great resource. They have quick references to frequently asked questions and a list of carriers that they have payment agreements with, and access to a helpful hotline as well, which is also in these slides. So we just want to say thank you, Becky, for joining us today, and everybody have a great day.
Great, thank you.
Yeah, thanks.